evening, everyone, and thank you for taking time to listen to my Doctor of Nursing Practice Scholarly Project presentation. My name is Evelyn Lydia Gyamfi, and my project is titled Impact of Medication-Assisted Treatment on One-Year Readmission Rate Among Adults Receiving Inpatient Treatment for Substance Use Disorder. Before I begin, I would like to acknowledge my committee members. My chair is Dr. Kathy Colton. My second reader is Dr. Teresa Garakatos, and my community member is Daniel E. Jamel, psych nurse practitioner. I sincerely appreciate their guidance, support, and expertise through this project. Today, I will discuss the background of the program, review the current literature, explain theoretical framework and methods used, present findings, discuss the implication for practice, and conclude with recommendation for future quality improvement efforts. Background and significance. Substance use disorder continues to be a significant public health concern in the United States. It is recognized as a chronic relapsing disease that often requires long-term treatment and ongoing support. Despite advances in treatment, many patients continue to experience relapse following discharge from inpatient programs, resulting in repeated hospitalizations, increased healthcare costs, and poorer healthcare outcomes. Medication-assisted treatment, commonly referred to as MAT, combines FDA-approved medications with counseling and behavioral therapies. Current evidence consistently demonstrates that MAT improves recovery, reduces relapse, decreases overdose deaths, and improves long-term treatment retention. Despite this evidence, MAT remains underutilized in many healthcare settings. My project sought to determine whether patients discharged on MAT experience lower one-year readmission rate than those discharged without MAT. These findings have important implications for improving discharge planning and strengthening evidence-based practice. Review of the literature. The literature strongly supports medication-assisted treatment as one of the most effective interventions for opioid use disorder and other substance use disorder. Numerous studies have shown that MAT reduces illicit opioid use, decreases mortality, improves treatment retention, and reduces hospital utilization. National organizations, including the American Society of Addiction Medicine and SAMHSA, recommend MAT as the standard of care for opioid use disorder. The literature also emphasizes the importance of the comprehensive discharge planning. Patients who receive appropriate follow-up care and continued medication management after discharge are significantly more likely to maintain recovery. However, relatively few quality improvement studies have examined one-year readmission outcome within inpatient substance use disorder treatment programs. This gap provided the rationale for my project. Theoretical framework. This project was guided by the Johns Hopkins evidence-based practice model. The model consists of 3 phases: practice question, evidence, and translation. First, I identified a clinical question regarding whether MAT at discharge influences one-year readmission rates. Next, I reviewed and critically appraised the available evidence supporting MAT treatment. Finally, the evidence was translated into practice by evaluating outcomes using existing electronic health record data. The Johns Hopkins model provided a systematic approach for integrating evidence into clinical decision-making and evaluating patient outcomes through quality improvement. Methods and design. This project used a retrospective quantitative quality improvement design. Rather than implementing a new intervention, I analyzed the identified electronic medical record data from adults discharged between May 1st, 2024 and May 1st, 2025. The project included adults 18 years of age and older with a diagnosis of substance use disorder. Patients with incomplete discharge or readmission data were excluded to ensure data accuracy. A retrospective design was appropriate because it allowed evaluation of existing clinical outcomes while minimizing cost, time, and risk of patients. Because only the identified data were analyzed, no direct patient contact occurred. Sample. The final sample consisted of 202 adult patients. Approximately 60% were male, while nearly 40% were female. Slightly more than half identified as non-Hispanic, with the remaining participants identifying as Hispanic. Among the total sample, 103 patients were discharged on MAT, whilst 99 patients were discharged without MAT. The two groups were similar in size, allowing an appropriate comparison of readmission outcomes. Data analysis. Descriptive statistics were used to summarize demographic characteristics of readmission outcomes. To determine whether differences between the two groups were statistically significant, I used a two-proportion z-test. This statistical test was appropriate because the project compared the proportion of patients readmitted within 1 year between two independent groups. The significance level was established at an alpha of 0.05 and 95% confidence intervals were calculated to determine the precision of the findings. Results. The results demonstrated a statistically significant difference between the two groups. Among patients discharged on medication-assisted treatment, only 29 of 103 patients, or 28.2%, were readmitted within 1 year. In contrast, 57 of 99 patients, or 57.6%, who were discharged without MAT experienced readmission. The absolute difference between the two groups were 29.4 percentage points. The two-proportion z-test produced a z-score of 4.23 with a p-value less than 0.001. The 95% confidence interval ranged from 0.164 to 0.425. These findings indicate that the difference was highly unlikely to have occurred by chance. The bar graph visually demonstrates the large reduction in readmission rate among patients receiving MAT, whilst the pie chart illustrates the distribution of readmitted or non-readmitted patients within each group. Overall, the findings support the conclusion that discharge on MAT was associated with significantly lower one-year readmission rates. Limitations. Several limitations should be considered when interpreting these findings. First, this was a single-site quality improvement project which may limit generalizability. Second, the retrospective design relied on existing documentation within the electronic health record. Third, medication adherence after discharge could be verified. Additionally, important social determinants of health, including housing stability, transportation, family support, and employment, were not available within the data set. Although these limitations should be acknowledged, they do not diminish the significance of observed association between MAT and reduced readmission rates. Discussion. The findings of this project are consistent with current national evidence supporting medication-assisted treatment. Patients discharged on MAT demonstrated substantially lower readmission rate than those discharged without MAT. These findings reinforce recommendations from ASAM and SAMHSA that medication-assisted treatment should be incorporated into routine discharge planning for patients with substance use disorders. The results also answer the project's primary clinical question by demonstrating the discharge on MAT as associated with improved long-term patient outcome. Implications for practice. This project has important implications for clinical practice. For patients, broader implementation of MAT may improve recovery, reduce relapse, and decrease hospital readmissions. For healthcare providers, the findings support initiating MAT before discharge and ensuring timely referral to outpatient treatment providers. Healthcare organizations may benefit through reduced healthcare utilization, improved quality metrics, lower cost, and enhanced continuity of care. These findings also reinforce the importance of interdisciplinary collaboration among psychiatry, addiction medicine, nursing, counseling, pharmacy, and community providers. Conclusions. In conclusion, this quality improvement project demonstrated that patient discharge on MAT experienced significantly lower one-year readmission rate than patient discharged without MAT. These findings support expanding the use of MAT within discharge planning and continuing to strengthen evidence-based care for individuals with substance use disorders. Future quality improvement initiatives should include multiple treatment sites and examine additional variables such as medication adherence, housing stability, social support, and outpatient follow-up. On a personal level, completing the Doctor of Nursing Practice program has transformed my professional practice. It has strengthened my leadership abilities, enhanced my understanding of evidence-based practice, improved my analytical and quality improvement skills, and prepared me to lead a meaningful practice changes that improve patient outcomes. I'm grateful for the mentorship of my committee, the support of my colleagues and family, and the opportunity to contribute to improving care for individuals living with substance use disorders. thank you for your time and attention. I welcome your questions. References. Below are the references. Thank you.